Hi guys, still on the Rcgp Sca sample cases which are freely available on the Rcgp website. This is case 4, sample case 4, and this is about Elisa Filipek. Patient's name is Elisa Filipek, and we'll be discussing results, so investigation results. Instructions to candidates. Patient's name, Elisa Filipek. Age, 72 years old. Social and family history. Married. Lifelong non-smoker. Occasional alcohol on special occasions, so social drinker. No family history of ovarian or breast cancer. So she's never smoked. Current medications, duloxetine 60 mg once daily in the morning. Past medical history. 20 years ago, she had a diagnosis of anxiety with depression, treated with a variety of antidepressants. 3 years ago, pelvic discomfort, diagnosed with a cystocele, and had a colporaphy. 2 years ago, she was seen again by gynecologists for pelvic discomfort, referred to the pelvic physiotherapist and prescribed estrogen cream. Neither helped. 4 months ago, she saw a gynecologist again for pelvic discomfort, and a CT scan of her pelvis and abdomen was arranged. A month ago, she saw a GP who changed her anxiety/depression medication to duloxetine. Last week, she received a letter from the gynecologist. And the letter from the gynecologist goes thus: District General Hospital. Dear General Practitioner, Elisa Filipek, Cherry Tree Farm. Dear Doctor, thank you for referring this lady for what looks like a third opinion into her pelvic pain. I understand she has long-standing pelvic discomfort, which she describes as a dragging sensation and discomfort when going for walks or on standing for extended periods. She's had surgery to treat a cystocele, pelvic physiotherapy, and used estrogen cream, none of which have helped. She asked for another opinion as her friend has had similar symptoms and was diagnosed with cancer. She was very anxious, but I could find no abnormality on examination, and more to reassure her than anything else, I organized a CT scan of her abdomen and pelvis. This was completely normal. I have let her know of the results. I have not planned to see her again. Yours sincerely, Dr. Nina Ja, consultant gynecologist. So she's had a normal CT. She's having this pelvic discomfort, long-standing with dragging sensation and discomfort when going for walks or standing for extended periods. It sounds like a venous congestion, pelvic congestion, which is like a varicocele, which is like varicose veins within the pelvis. So there's some venous congestion causing pelvic compartment, pelvic congestion syndrome. That's what it's called, I think. Questions for discussion and notes. Is there any helpful information in the case notes to read before starting the consultation? Is there? There's lots. you look at her past medical history, first of all, if you look at her social and family history, she's never smoked, which is a good, so that's low risk from that side. She knows no family history of ovarian or breast cancer, which is good. She's a social alcohol drinker, nothing massive, nothing significant. If you look, she's had anxiety and depression, she's had several antidepressants. Is there a possibility that this long-standing pelvic pain, pelvic discomfort is just driving this lady depressed into depression and anxiety? Anxiety probably from, oh, do I have cancer? Is there something serious causing this discomfort? This dragging sensation that she keeps having. So she's had depression, anxiety, she's tried several medications, still not well, which shows you that most likely the cause of her depression is still there, it's lingering. She's had pelvic discomfort, she's seen a gynecologist on several occasions, she's eventually had a CT scan, which is normal. She's still probably not going to be satisfied because her symptoms will still be there, and that's understandable. How might you integrate the information gathered at previous consultations, as well as the current presentation of the patient, in order to formulate a treatment plan? So you can say things like, I can see you saw my colleague a month ago because you were still struggling with your mood and you were switched to a new medication. Have you noticed, how have things been since then? Have you noticed any side effects? Has there been any benefits you've noticed in terms of your mood with this new tablet? I can also see that you've had several contacts with the gynecologist and you recently had a CT scan 4 months ago. Are you aware of the result of the scan? It's okay. Does this reassure you? What does this result mean to you, especially with your symptoms? How are you? What do you feel about this normal scan? You know, because she might be disappointed. She might be hoping that the scan will find the cause of her discomfort, the cause of her pain, which the scan has not. So she might be disappointed with that. So the CT scan didn't comment about her pelvic congestion actually, but from her symptoms, that's what it most likely is. How do you think the patient is feeling about her pain and about the investigation so far? I would say a mixed feeling, mixture of gratitude or happiness that it's not cancer, but also a feeling of disappointment that the scan has not found a definite cause of her pain, something correctable, a correctable cause of her pain. Why do you think it is particularly hard to bear this pain? What are her wishes and preferences about next steps? And how can we involve her in planning for these? In terms of next steps, you would explain to her that the symptoms you're describing, especially because it's more of a discomfort than actual pain, and it happens more when you're standing, which means I'm thinking there's an effect of gravity pulling blood down into your pelvis. I'm suspecting you could have varicose veins within your pelvis, which we call pelvic congestion syndrome, where because you're standing and because maybe very likely the valves that your veins normally have valves that help to direct the flow of blood. If those valves become faulty and we stand under the impact of gravity, the blood is pulled into our legs, our pelvis, you know, and it causes congestion, increased pressure within that area, causing these discomforts, just as you are describing. This is what I seriously think is causing this discomfort you're having, especially with your normal scan. How do you confirm pelvic congestion? The scan should actually have shown maybe some dilated tortuous blood vessels. I'm not sure if they need to do an angiogram, pelvic angiogram, to confirm that. I don't think a pelvic angiogram would be an overkill for that, to be honest. What are her wishes? It's always good to know. Now that you've had this, what do you think we should be doing? Is there anything you're thinking, you know, you want us to do to help as a next step? What treatment options are possible or evidence-based for pelvic congestion syndrome? I don't really think there is Is there a treatment? I'm not sure. What you need to advise is probably exercises. She might need some occupational adjustments. So if, for instance, she works in a kitchen, or if her job involves lots of standing, she might need some occupational adjustments, involving the occupational health department at her workplace, to see if they could give her a desk job where she does more of sitting than standing, and things like that. If it's the legs, you could use compression stockings, but for the pelvis, I'm not sure there's anything that could actually compress the pelvis to improve blood flow upwards. What follow-up might you suggest? How might continuity of care help? So in this kind of situation, you say, I'm reassured with your normal scan and with the nature of the symptoms you're describing, which makes me believe it's varicose veins within your pelvis. However, if you begin to notice signs or symptoms that will make us begin to worry more, symptoms like if you start losing weight, if you start developing worsening pain, if you notice swelling of your tummy, bloating, swelling of your tummy, any changes in your bowel habits, any changes in your urinary habits, passing your water walks habits, I would say come back to us, and then at that point we'll need to go through your symptoms again, examine you, and decide if we need to be repeating some of these investigations. What are your thoughts on this? You know what I mean? So the purpose of this case is to support, manage, and advise a patient who has ongoing symptoms of pelvic pain, with all physical causes excluded, sensitively and empathically. So it's more likely pelvic congestion syndrome. There's really nothing much. You're not going to, if it's varicose, you could do a varicocelectomy. In pelvic congestion syndrome, I don't think they do varicose vein treatment yet, but I will need to double check that to see if there's a room to do a laparoscopic ligation of certain veins in the pelvis to reduce that congestion. I'm not aware that such is done. I'm just thinking I'm not thinking of the surgical possibility, but I don't think it's something that is done. It's probably something she will have to live with. She might need some CBT. So because she's depressed as well, she has CBT, cognitive behavioral therapy, something we need to be talking about. I see you've tried several medications. Have you heard about CBT, talking therapy? Is this something you've tried before? Is something that's previously been offered to you? What are your thoughts on speaking with a psychologist, a specialist, to go through some of these, low mood, anxiety, and even some of this pain that you're having? So CBT is a chronic pain syndrome she's having, so CBT is also very helpful in management of chronic pain syndromes, chronic pain. So we've come to the end of these fourth Rcgp Sca sample case. I wish you all the best. I also wish myself all the best because I'm doing the exam next month. Cheers, guys.